mega podcast star Joe Rogan has revealed that he got COVID. Now, he posted an update about it on Instagram. Check it out.
And turns out I got COVID. So we immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, Ivermectin, Z-Pack, prednisone, everything. Here we are on Wednesday, and I feel great.
Wow. One of the drugs Joe mentioned he was taking was Ivermectin, an unproven drug used to treat parasites in livestock. The FDA, by the way, has warned people not to take it, tweeting, "You are not a horse, you are not a cow. Seriously, y'all, stop it." Earlier this year, Joe spoke out against the COVID vaccine, telling his younger listeners not to get it, which is against the recommendations of doctors and disease experts. He kind of walked those comments back, but what are you thinking now?
Just hearing you say that Joe mentioned something, I don't even know if we can use that word when we're talking about him. We're talking about a podcast that gets over 100 million downloads a month, Sam. No one knew when podcasts first started out that anybody would have any kind of patience for a half an hour interview, much less a 2 to 3 hour, 4 hour interview. But now we found that out, and Joe Rogan specifically found that out. So that means that Joe Rogan is in his listeners' ears 25, 30 hours a week.
Wow.
People hear Joe's voice more than they hear their spouse, their boss, their doctor, the president combined. And so when he can't mention anything anymore, when he says something, Erica, it is law. When he says something works, it works. When he says take something, people take it. And when he, even if it's not nefarious, which I don't think it is, I met him before, a nice guy, it doesn't matter. The kind of power that his words wield have to be taken with so much grace in his, because I don't think he ever meant to be this powerful, but that doesn't make him less powerful.
I'm angry, and I agree with everything you said, but when he mentioned throw the kitchen sink at him, that's such a privileged thing to say. I remember our very own Dr. Coley and my sisters and I begging doctors to throw the kitchen sink, using that same terminology that we heard from doctors to throw the kitchen sink at Eric. It's not that easy. Eric's a healthcare worker. They weren't able to throw the kitchen sink at Eric. I wonder if the kitchen sink was thrown at your aunt, Erica. So that's not likely for most people. Really? Kitchen sink when my brother-in-law is a healthcare worker and he didn't even get the kitchen sink thrown at him? Unfortunately, I'll just let you talk. Go ahead, Erica.
Well, yeah, I mean, most people, my aunt included, are turned away because our healthcare system is overloaded. That is really what we're talking about. People can go back and forth and talk about politicizing it, but ultimately we do not have the bandwidth, our health medical professionals do not have the bandwidth to handle this. Joe Rogan has not been underprivileged or poor for quite some time. Many of his demographics are going to receive that same treatment. And we've had Dr. Coley, where I've point blank asked her, what's the triage protocol? The triage protocol at this point is if you are going to the hospital with COVID, for many hospitals, that if you are vaccinated, you get seen before the unvaccinated. If you have a terminal illness or you are in some type of accident through no fault of your own, you are seen before the unvaccinated. Joe Rogan gets seen first because Joe Rogan has access. That's access that people who relate to him cannot relate to his pockets. They can't. So is he saying, is what he's saying true? I'm not disputing what he's saying may be true, but the truth is it doesn't apply to you.
Yeah, and I think all our viewers need to be aware of that and just remember that he is not a doctor, he's not an expert.
Fear Factor, guys. He's the host of Fear Factor.
Yep.